Hello everyone. Welcome again to my blog Sumud. This conversation today is part of my fellowship with HPHR Journal, formerly known as the Harvard Public Health Review Journal, part of the Boston Congress of Public Health. Today we'd like to discuss the issue of refugees' health in Jordan, specifically within the COVID-19 pandemic, with the renowned Dr. Akihiro Seita, the Director of Health at UNRWA, the United Nations Relief and Work Agency for Palestinian refugees in the Near East. So UNRWA is the UN agency responsible for Palestinian refugees, and it's equivalent to the UNHCR for the other refugees. Hello, Dr. Seita. It's a great pleasure to have you here with us today. Thank you for giving us some of your precious time to discuss this crucial issue.
Yeah, good morning. Thank you very much for inviting us. Thank you very much.
Thank you. If we could start by telling us about UNRWA, a brief history and scope of work that you do.
Yeah, UNRWA was established in 1950 to take care of the Palestinian refugees, which occurred during the first Arab-Israeli war. And then the people who used to live in the historical Palestine left for Gaza, West Bank, Jordan, Lebanon, and Syria. And then as of today, it's around 5.7 million Palestinian refugees in these five, we call it the fields of operations. And the UNRWA provides protection and support to these refugees. That includes education, health services, and other services. And it's one of the largest UN agencies specifically focusing on the Palestinian refugees.
Mm-hmm. Yes, UNRWA was very well known for its long history and great work that many others are trying to replicate. I know that it's specifically for its health system and health work in the different fields. And
thank you very much. Yeah, it's true that we have a very good education and health services and the long-standing services, but UNRWA's original mandate was 3 years, and then this program of the Palestinian refugees should have been solved long times ago, decades ago. So it's good that UNRWA still exists and providing the services, but it's an international shame that UNRWA is still here, that we need to provide support to Palestinian refugees. Yeah.
Yeah, that's unfortunate that this situation is still not resolved politically. And can you tell us about the living situation of Palestinian refugees in Jordan, and how is it affecting their health in general?
Yes, there are around 2.2 million or 2.3 million Palestinian refugees in Jordan. Jordan hosts the largest number of Palestinian refugees. And they are living in the official camps, but also outside the camps. Because of long history of the presence in their stay in Jordan, majority of them are staying outside the camps, but there are still camp people living in the camps. The health condition of such Palestinian refugees, the main cause of leading cause of death are non-communicable diseases. It's diabetes, hypertension, cancer, and lung diseases, and it is because they are poor. In the developing world, that the healthy lifestyle is quite often very expensive to access, and it's not easy for the refugees to have a very healthy lifestyle, because the food variety is very expensive, like meat and the fruits are quite expensive. So many people's staple food is a government subsidized bread, which is quite cheap. If you pay one Jordan dinar, which is almost $1.4, you can get 2 or 3 kilos of the bread, and that's a staple food. And then there's no much access to the healthy lifestyle or like jogging or walking. And then that's the reason that the main health reason in the Palestinian refugees living in Jordan is non-communicable diseases.
And how are the living conditions in terms of housing? How much are the places they're living in or neighborhoods overcrowded in Jordan?
Jordan itself is quite a crowded place because of the people who can live in the places are quite limited. But at the same time, this is the 70 years refugee food. And so you can easily imagine that it's not like they are living in the camps or tents. Sorry, living in the tents. They're living in the houses and the concrete built. But if you go to refugee camps, it's really crowded, narrow street, and then very crowded situation, quite congested. So it is not a good living condition.
Mm-hmm. Yeah. Okay. And so now when COVID-19 started, how was the situation of COVID-19 among these refugees in Jordan?
Yes, COVID-19 is the biggest, not only health, but the entire society economic shock to the Palestinian refugees. And like what you have seen in many parts of the world, that the poorest suffer the most. Same for the Palestinian refugees in Jordan. So that many of them lost the job. I met one lady whose husband lost the job for more than 6 months. And her husband's job is a day labor at the construction site. Because at the start of COVID-19 pandemic, that many construction activities stopped, and so many of them lost the job. So it is a very heavy economic shock to the many Palestinian refugees who are poor in Jordan.
Mm-hmm. And were there many cases among these refugees?
Yeah, Jordan so far have the 3 waves, and we are worried about the 4th wave may come in. And since they are living together within the community, that when the Jordan is affected with the COVID-19 waves, outbreaks, the refugee also affected outbreaks. So yes, they are affected COVID-19 very seriously.
Mm-hmm. And are they tested? Do you have, or any other agency have testing programs specifically for these refugees?
Yes. Yes, they have access to the PCR test and hospital care. Mm-hmm. What is important, what is great in Jordan is that the COVID-19 response, the national response, it's not only the UNRWA response, the Ministry of Health response, UNHCR response, etc. It's a combined response for nationals. Jordan the government provided the PCR care for those who are suffering from the symptoms, regardless of their background. And the Jordan government provided the hospital care in the government hospitals, regardless of background. So that the refugees have access to the PCR test, like Jordania have access to the PCR test.
Mm-hmm. Yeah, that's great to know, because in some other countries you see separation of nationalities, or some refugees are not able to access these tests or hospitals. So that's great to know. And what other interventions did UNRWA have during COVID-19, for example, in terms of maybe hygiene or raising awareness?
Yes, in general, that we promoted the social distancing, the hand hygiene, and all others to the entire refugee communities. Jordan took initiative by working with the communities to promote such ideas. At the same time, we have 25 health centers in Jordan for UNRWA. And in these health centers, we did a couple of things. One is that the introduction of that triage, which is that they are measured with the temperature, patients are measured with the temperature, as well as symptoms at the entrance. And all the staff are provided with personal protective equipment or PPE, so that it will protect the refugee patient as well as staff from the COVID-19. At the same time that we maintain the life-saving critical services, we have around 70,000 people with diabetes, hypertension. And so that even the lockdown time, we made our efforts to make sure that they continue the medication, which is life-saving. And in the serious lockdown time, that we provided the home delivery of the medications. So by protecting the health staff, but continuing the health services, that's what we've been doing to the Palestinian refugees.
Mm-hmm. That's great. And were there any challenges faced while providing these services, or maybe in terms of raising awareness?
Yes, it's like the major challenge is that the people's awareness or acceptance of the COVID-19 and its responses. Mm-hmm. As you can see in many parts of the world, that when the COVID came in, at the first time people got shocked, freaked out. And so they follow the restriction measures or protective measures very seriously. But when the first wave, second wave, third wave, that the people started relaxing, and this still is a very serious situation. Say like hand hygiene, the masks are not well maintained in the community. But I will not blame them. This is because that for them that life is more important than COVID. And the people living their daily work or daily job, that stopping the daily job because of COVID is like, going into further poverty. And so the people have to live, and that's one of the big reasons that people maintain such behaviors, but also that's the biggest challenge we have.
Mm-hmm. Yes, I think it's global that you see this issue of is it lockdown versus going to work? The financial situation would be affected, but at the same time you want to protect human lives. So you have to find this balance. So in terms of, I know that UNRWA during the past few years have been facing some financial difficulties. Has this situation gone any better, or how are you facing in terms of COVID interventions? Were you able to secure finances as you needed?
Yeah, if we speak about the COVID specific interventions, we got a good international support. Mm-hmm. But if we speak about the UNRWA at large, we are in a very bad financial situation. So if you go to the COVID-19 response, that we received quite a good amount of support to provide a PPE and then the hand hygiene sets, as well as technical guidelines from the Ministry of Health and then also that WHO and the international agencies. At the same time, that if you speak about the vaccines, mm-hmm. that we work with the government very closely, Jordan government very closely. And the government of Jordan wonderfully included all the Palestinian refugees in the national vaccination plans. Mm-hmm. And so the Jordan government started vaccination in early this year. Many refugees got it as in the way that same way that Jordanian got the vaccines. Say, I myself, I'm not a refugee, but I'm a foreigner working in the UNRWA for health services. I received my first vaccines in the first day of the Jordan vaccination campaign because I'm a health worker. And so Jordan is a fantastic that including all the Palestinian refugees in their national vaccination plans. Mm-hmm. The trouble is that they do not have enough vaccines. It's because of the global vaccine inequality that this Jordan government vaccination coverage is still 40–50%. And it's largely because of that the vaccine is not supplied or delivered to Jordan on time. Mm-hmm. When the delivery delays, vaccine hesitancy increase, and it's a bit catch-22 situation. I think that's the biggest lesson we learned in the COVID-19 pandemic, that such an inequality we should not have happened in the way that the people didn't want to see. And I think it's largely responsible for the Western industrial world, but it's a really sad situation that the people working like us in the global health, that the world still remains like this, which is not acceptable. Mm-hmm. For the UNRWA entire financial situation, it is very serious. We still are in short of that $60 million for this year, which means that the salary for this month and the next month of this year is still at risk. And we've been working with many donors to get more financial support to make sure that we can provide the salaries for the UNRWA staff working for the health and the education and the other services, which in total are 30,000 staff. So it is a very bad situation.
Mm-hmm. I hope that it will become better very quickly, because the situation of the workers and the refugees is not doing well, especially with the COVID-19 pandemic. So you mentioned vaccine hesitancy. Did you see that this is common among the Palestinian refugees in Jordan?
This is common in this part of the world. Let me explain how it went through. When the vaccine came in, that many people were reluctant to get the vaccines because of these rumors, the social network services, and others. But when the vaccine really came in, and when people see the vaccine, which they like the most, people come and they vaccinate. And when people see that her or his neighbors, families, others got vaccinated and doing well, they start coming this. And in this sense, that what I learned from my experience in Jordan is in the community where there's a huge amount of vaccines easily available, and this vaccine is what people prefer to take, then people come and take it. And in this part of the world, that it was Pfizer. And at the early days, Sinopharm, and not in Jordan, but other places, Sputnik, Russian one. What was not people's favorite was AstraZeneca. It's because of that the issues took place in the European countries early this year. And the people still think that AstraZeneca is quite not a good vaccine, which is not true at all. So that's one part. The second part is that the situation is changing. One is that people tend to get the vaccines, particularly for those who wish to have international travelers. And then because nowadays without vaccine that one cannot go abroad. So I think that's also the push factor. Not the positive factors, as I said. If the vaccine is not, if the vaccine comes late to the community, that the longer the delay happens, the more vaccine hesitancy occurs. I think that's what we really need to address very quickly.
Yeah, so this would need to push more for a quicker response, and the international community to prioritize the countries that are most in need and the communities there as well. Okay, and what are your recommendations on a policy level for improved health of refugees in Jordan?
The number one is that support UNRWA, support the agencies, because this is fundamental that we continue to provide the services. We have 5.7 million refugees to serve, and we have around 300,000 people. I'm talking not only Jordan, but all the 5 places of UNRWA. We have 300,000 Palestinian refugees with diabetes, hypertension to care. We have 90,000 in all the 5 places of Jordan, new pregnancies every year, which includes the vaccination after the delivery of the babies. And so it's important to maintain this agency like us to operate, continuously operate. The second important recommendation is support host countries. During the amid of the COVID-19 pandemic, the wave, that many government hospitals were about to collapse because of a lack of beds, even in Jordan. And then so that access to the hospital became a nightmare to many people who are having the symptoms. And but Jordan is better off among the other parts of this, among the other countries in this part of the world. But say Palestine, Lebanon, Syria, for example, they really need more support from the international community to maintain the effective COVID-19 responses, as well as health systems at large. So that's the second part. The third part is important for the international collaboration. It is a shame for the global health community that the global vaccine inequality happens in this unacceptably huge way. And this is our challenge for the future, to how to avoid global vaccine inequality. That's the biggest challenge we have in this part of in the world at this point of time.
Yes, there were already many issues, and now with COVID and the vaccine, we're seeing that a lot of other problems have come up that the global health community need to think of and consider for this pandemic and future pandemics as well.
Sure. But what I think is that we better focus on one thing. We said universal health care. If you can solve this vaccine inequality, I think we can move to universal health care. If not, it's very difficult. Then my biggest worry is that now that oral pills of say COVID-19 medication are now approved in many parts of the world, and this should come to the developing world in the way it comes to the developed world community. That's the biggest challenge we in the global health community faces now.
Yes, definitely. And what advice would you give to anyone watching this conversation and would like to help in one way or another?
Yeah, let me be the short side, but UNRWA is in financial crisis. Please continue to help UNRWA, and there's a donation site in the UNRWA.org, and I really appreciate your continued support. But more importantly is to continue to give attention to the refugees' life. In the COVID-19 era, it is everybody's problem, and then that we rightly focus on the life of their own country and the neighboring countries. However, there are a huge number of refugees and internal displaced and the migrants, which usually have less access to the COVID-19 care. And so it's important that we never forget, but to continue to mention and the support to the refugees and all other vulnerable people.
Mm-hmm. And I think even after, hopefully we're done with this pandemic, the problems will still continue unless there's this support and, like you said, equality in terms of services between developed and developing world. Okay, so this has been a great discussion and overview of the health situation of refugees in Jordan. A hopeful conversation, and hopefully that there's even more ongoing work by UNRWA and other ministries and agencies. Thank you very much, Dr. Seita. I wish you and the UNRWA teams worldwide the best, and I hope that the situation will be better for your teams and the refugees in Jordan and migrants all over the world. And I hope one day we will reach a day where we don't even need to have this conversation, where the situation is much better.
Okay, thank you very much. Thank you really so much.
Thank you so much.
Yep, bye-bye.
Bye-bye.